So in this video, what we're looking at is a demonstration of massage on the arms. Now, hopefully what that gives you is an idea of how some of the techniques could be applied or linked together in what can be quite a difficult and often sort of undervalued area to treat. So what we're looking at to start with is sort of applying the lotion. So again, as you would on any other area of the body, some nice effleurage techniques, longer, a little bit slower up through the arm to give you a little bit more control can be really helpful.
As you've noticed, Charlotte here has started with the upper arm first. So with limbs, always flush the upper arm before working the lower arm. So we recommend that you apply lotion to the full length of the arm, then work the upper arm and then work the lower arm. Also, the really important thing to look at here is Charlotte's posture. Where she can, she's keeping her arms nice and straight. Her back's nice and straight, and you can see she's got a nice strong lunge position on. Also, her appearance here is really good. So she's got her hair tied back and a professional look.
So you can see immediately there, in order to do some petrissage, I've changed the angle. So I've moved my body. What we can then see, of course, is you change the lunge and a little bit of need to support the elbow. So you can do a little bit of picking up there as well as the actual sort of ringing. Now with a smaller area like an arm, one hand might be appropriate for that. Do just make sure it's dependent on the person you're working with.
So here we've got a little bit of butterfly. Sorry, got my teeth stuck there. This is a really controlled technique. So it's not, you do tiny little areas with it. You don't do massive areas with butterflies. So you can just see Charlotte working up through the line of the bicep there. She's obviously found a nice tight bit. Probably tell by the look on my face that I'm not overly impressed with that. And then she's gone to flush through with sort of more of a cam and spindle, but that's a one-handed cam and spindle purely because she's got a small area to work on, so there's not a huge amount of pressure. She's also using her body there to support the arm, to give her a little bit of control, and that's fine. I use my legs to support arms all the time. And then, as you can see now, Charlotte's gone to work down in a nice... Is that a compression or a friction you're doing to me there?
I think we're looking at a compression at this point.
Yeah, and that's going to be nice there, I think. But yeah, so you can see she's found a nice tight area, working on it. And she's also communicating with me because you can see her looking me in the face there to sort of check that everything's okay.
So especially on the arms, because it's sort of picking up on what Tamsin said, because it's an area that actually a lot of people don't have treated very often. I find that communication while you're treating the arms is actually really almost more important than it can be for other areas. Not that you shouldn't ever use it on other areas, but people actually are often really sensitive through their arms. They're not a large area. There's a lot of nerves, a lot of dexterity. So just make sure you're always really controlled, really communicating with your client what you're doing and what you're trying to achieve as well, and the benefits for them.
Because the other thing as well, when your clients face up like this, especially when you're working this close to the top half of their body, they're looking you in the face, so they can get a little bit lost almost and not know where to look or what to do if you're not communicating with them. So it's really important to make them feel comfortable by communicating well at this point.
So again, now moving on to what's sort of going on technique-wise, we're just looking at some really nice sort of flushing, almost effectively gliding off both sides of the bicep here. That will help to flush through the arm, especially where we've done a little bit more deep work, such as those pressures. And then again, full length of the arm, flush the whole area through, make it a little bit more comfortable.
A lot of people don't do much work on the arms, and it is really important to get good at it. There's an awful lot of sports that are arm-based and work-related problems. So you've got SRIs, tennis elbow, golfer's elbow, so your epicondylitis, things like that, where there's going to be issues. And people just get really, really tight arms because they don't have them treated. So they get a lot of pain and discomfort. And obviously the muscles in the forearm, they're doing a lot of control work of the hand because these are the main muscles that will do most of the finger dexterity stuff. And they're tiny, tiny sort of muscles with long tendons. So they do tend to get quite heavily worked. So it's really important that you know how to treat this area effectively and well.
Absolutely. So you can see here the arm is always being supported. We've moved on to treat Tamsin's forearm here. But again, the arm is supported on her own body, but also you can see that I've used my hip effectively to make sure that that wrist is supported. It's not going to drop off the side as I'm putting a little bit more pressure down through into the elbow region. So what you don't want, especially when you treat it, when you're treating at all, is for the limbs to sort of end up flopping around, losing control. that means that A, your techniques aren't going to be as effective, B, your client's actually not going to be very comfortable. And as soon as they start tensing up, you'll find that your results of your treatment aren't so good. But you can see here the variety of different effleurage and petrissage techniques you can do, even on a very small area such as a forearm.
So if you went on to your level 4, for example, there are some really good techniques you can add in here as well, which will work really, really well with small areas like this. But obviously we're looking at level 3 today, and there is still a huge amount of techniques there that you can use, as you can see. So there's always benefit to having some more advanced skills for a small area like this, but you've got your level 3 skills that you can use really, really effectively.
Absolutely. Now, what I want to point out here as well is just notice how much I've moved the arm around just while we're treating the forearm to make sure it's in as good a position as possible. And even now, as we move into a little bit of shaking, see, everything's moving. I'm not afraid to move my body. I'm not afraid to move the limb to make the treatment as effective as possible. So make the body work for you, but without putting your client at any stress, and make sure you move your feet. It's really important, especially when working arms. Nice little stretch there as well to finish. So that is how you'd put together a few ideas for treating an arm.